So South Africa, as we indicated, is now in the top 5 globally in terms of the number of infections. So the first 17 experts, you heard Samkele say there, will touch down in the country tonight and will complete their period of quarantine before being deployed within the department and across various provinces to analyse our country's response to COVID-19. Let's chat about this now to Professor Lynn Morris from the National Institute for Communicable Diseases. Prof, a very good evening to you. Thanks indeed for your time. So what does it mean for South Africa in its continuing fight against this global pandemic to have WHO experts being brought into the country to assist in this fight against the pandemic?
Good evening, Griselda, and your listeners, and thank you very much for inviting me to discuss this. So, yes, as you've mentioned, a number of WHO experts, and some of them arriving this evening, and some additional ones will be arriving later. And they're really here to share their wisdom with us because, you know, they've been dealing with this pandemic right from the very beginning. Mike Ryan, who is the epidemiologist at the WHO, has been leading these efforts, is one of the people that will be coming. And, you know, they've been dealing with the outbreak that was in Asia, and then as it swept through Europe, and then in the Americas, and now, of course, in Africa. And so we really can learn a lot from them in terms of how we can manage this epidemic going forward.
Professor, let's come back to domestic issues in terms of where we stand with COVID-19. To date, over 3 million people have been tested, and we have more than 500,000 cases of COVID-19. Compared to what we are seeing globally, are our country's testing and tracing methods working?
So, you know, with this number of infections, obviously, and the number of contacts, you know, the tracing is a very difficult exercise. But we're using multiple different ways of tracing, including a new digital method of tracing contacts that just has, you know, started in the last few weeks. And so we are, you know, really trying to trace contacts because that's the best way to, you know, to try and prevent the spread. But you know, it is a tough job to trace that many people, and so that's why it's really important that people, you know, actually try and prevent the spread themselves. You know, people need to you know, keep away from other people and avoid too much contact. You know, to really try and themselves actually take responsibility for stopping the spread.
Prof, a bit earlier on today, the Minister of Health talking to us about what seemed to be reduced hospital admissions. What can we read from this? Has this got anything to do with exactly what we know in terms of how many people have been infected? What can we attribute this to?
So, yes, so we are cautiously optimistic that we are turning the corner. Certainly, we've seen that in the Western Cape. We've seen the epidemic there is definitely flattening out and starting to come down. And we're seeing signs of that now in Gauteng and the Eastern Cape. And we're seeing that both in terms of the numbers, but also in terms of the hospital admissions. And so in fact, we haven't exhausted some of the surge capacity that we built in some of the hospital system. So it is a positive sign. But it's by no means, we're not out of the woods by any means, and we still really do need to all try and, you know, prevent this virus from spreading further. You know, this virus basically, you know, moves between people, and so we have to really try and break that transmission chain.
Prof, just looking at the infection numbers, I mean, what could this possibly mean going forward? For example, with the lowering of lockdown regulations, what would that mean for the country?
So that is, I mean, obviously right now, you know, we still have restricted, you know, travel, particularly interprovincial travel. And, you know, one of the concerns is when people start moving about between provinces, that we will start spreading this virus. You know, and that's how the virus, you know, that's how it gets around is, you know, it travels with people. And so there is some concern that when these, that when we lift the restrictions, that there will be another surge of cases or, you know, another a resurgence. And so that's why, again, we just need to really continue to practice all the safety measures to avoid that from happening. Because obviously we cannot stay in lockdown forever.
Yeah.
People do need to get on with their lives. And we almost need to learn how to live with this and learn how to adapt and change our behaviour.
Professor, thanks indeed for your time this evening. Professor Lynn Morris from the National Institute for Communicable Diseases, thanks indeed for your time this evening. Let's take a short